can organizations help senior leaders with their stress and mental health as we move into this next phase of the pandemic? Well, to talk about that, I'm joined today by Paula Allen. She's Senior Vice President, Research and Total Wellbeing at Lifeworks. Hi, Paula.
Hi, good to see you.
Well, great to have you here today. And I have a lot of questions about the research you've done and the conclusions, but I always like to start by asking people about their own careers. How did you end up doing what you're doing?
Well, it was a long journey. I started out working with children, mental health, worked with adults, people with disabilities, including brain injury, and really had the great fortune of looking at workplace health and productivity from a number of points of view. So from as an advisor, as a leader in product development, in manager training and support. And for sure, I got to the point where I realized there's a lot that we need to know and really focused on research to help us know that.
So you're with LifeWorks, and there's a lot of things we could talk about at this point in the pandemic in terms of, HR issues and organizational issues. But the organization decided to tackle the issue of mental health and put out this survey. How did that come about?
Well, mental health is the core of well-being in every respect. I mean, I learned that as part of my career experience. The organization knows that quite clearly. It's really the center of the quality of life, your relationships, your productivity at work, even your participation in the economy. So we have a focus on total well-being, but a particular focus on mental health. And with this leaders survey, we also understand how important leaders are to a workplace. And there really hadn't been much focus on senior leaders. So the people who are actually steering the ship. So we felt it was important to understand their experience, their perspectives, what's changed for them in the pandemic. And that's why we focused on that particular data set.
Well, you actually managed to quantify this. You have an index of well-being, right?
Yeah, we do actually. We actually started developing it 3 years before the pandemic even hit. So we knew how important it would be for organizations going forward to have a clear, clean, understandable measure of the mental health of working individuals. And that really wasn't available. We had public measures that included, people who aren't working. We had data that was available late. We had fragmented data from service providers. So we really felt that there was a gap to fill. So we launched this mental health index in April of 2020 and have been able to really very clearly track the mental health status of working individuals in Canada, US, UK, and Australia. And as importantly, get some data that helps us understand why we're seeing what we're seeing.
We'll talk about the overall reading on it. I'm interested to know how it changed since April 2020 to a year later.
So the way the index works is we took the data that we've been collecting between 2017 and 19 and set that as our baseline. So that was set to 0, and it really is made up of a number of different components. Experiences of anxiety, depression, optimism, isolation, a number of things that we know are really important in terms of understanding the mental health status of a population. So 0 is the baseline. And when we started to publish in April of 2020, we saw a massive decline. So not surprisingly, we believe that that's directly related to the impact of all the change and uncertainty of the pandemic, but a significant decline. And we've seen a little bit of an inching up, especially over the last few months with increased optimism, but we are still significantly below where we were before the pandemic. This has actually put a massive strain on the mental health of the population.
I mean, I know 0 is your baseline, but you obviously watch this pretty carefully. When you look at the situation before the pandemic, how would you characterize mental health then?
I would say that we were maybe a 6.5 to 7 out of 10. There was a lot to be done. So we know a fair bit. We know how the human mind works. We know there's still a lot more to know, and that's why research is so critical. But there are many things that were happening in workplaces that really didn't take advantage of that knowledge. So we know, for example, that stigma is a major factor. It's not just a factor in terms of people feeling uncomfortable speaking with one another. It actually prevents people from getting care. It actually prevents people from taking care of themselves because they don't want to self-identify with something that's stigmatized. We know that the role of leaders is absolutely critical in terms of creating an environment that has psychological safety, which is foundational to proper well-being. And that we know that that psychological safety, essentially feeling that you can be yourself and won't be reprimanded for being honest about things that you see, not only even in your personal life, but in your work. We know that that's a factor not only in people's well-being and sense of belonging, but it's also a factor in how effective the work team is. There's several other things that we know around managing disability. There's several other things that we know, but we haven't really fully executed on it. So I think there was still a lot of room for improvement. And right now, as a result of the decline in mental health, it's become absolutely urgent. It's no longer just important, it's urgent.
Well, it's great that you're getting some information around this so we can understand it. Tell me about the study with Deloitte. It was pretty comprehensive.
It was, and as I said, through our mental health index, we have a very clear understanding of where the population is, the general population. And we also did a bit of a deep dive in frontline managers. And what we found there was quite interesting. We found that frontline managers, for the first time since, we have data on this, their mental health was actually more compromised since the pandemic than people who didn't have management responsibility. And this is upending, our typical pattern, because typically managers are a little bit older, they have good problem solving skills, because, you wouldn't become a manager if that wasn't the case. They have a whole lot of protective factors. But that situation pre-pandemic was upended by the level of accountability and stress and, dealing with everything everybody is dealing with, plus having to work with a team and support a team and answer questions when there weren't any answers. So that we found very interesting. But that group didn't include executive leaders, senior leaders. Mm-hmm. So we felt it was a missing part of the data set, and we collaborated with Deloitte in order to fill that data. And that really was the purpose of this study. And we did definitely find some interesting results.
Well, how does it differ between frontline leaders and really senior leaders?
Well, what was very clear was two things. The level of strain for the senior leaders was much more than the level of strain for the frontline managers. And when you think of how even I described the reason why frontline managers have more strain than non-managers, non-people leaders, you can understand what that actually gets exacerbated the more significant your scope of responsibility. So that was one thing. The other thing is that, if we look at some of the things that create problems with people dealing with the strain that they're dealing with, it is a sense of isolation. It is stigma, which is also very isolating. And we found it very interesting that the senior leader group had much higher sense of a career-related stigma if anyone were to know or feel that they were struggling. Like that was quite astounding. We have it in our society. It was more with frontline managers than non-managers, and much more with senior leaders. So that was definitely a factor.
It's really interesting because I would have thought a lot of this would have been there before the pandemic too. However, I guess no one's had to step up quite like this, right? This is career changing.
It's career changing, and there's a well-established model of stress, in particular workplace stress, that looks at three factors. The level of demand that you have, what's expected of you, the level of control that you have, your ability to rally resources and make things happen, and the level of support that you have. And if you think about that model, what's happened as a result of this pandemic is the demand of these senior leaders became uh, exploded overnight. So it's high demand work to begin with. It's high stress work to begin with. And then literally overnight, you're having to wonder about, how am I going to keep my people safe? How am I going to keep my business going? Is my business model going to survive? Supply chain, how am I going to deal with the supply chain? Do I open my stores across the country on Monday, and I'm sitting on pins and needles to see what's going to happen in terms of the requirements and restrictions on Thursday evening? Like the level of demand exploded. And really, we still have pretty high demand. We still have businesses really wondering about what's going to happen in the transition back to the work site if that happens, what's going to happen long term in terms of their business model, all of these things. So that's one thing that's increased. But the other thing that happened is the level of control
Mm-hmm.
declined, right? Because usually you understand what levers you can pull, you understand how you can make things happen, understand how to execute your decisions, because these are things that you're used to doing, you're used to a particular structure. But because this was a public health issue, then what people could do and the decisions that could be made were well out of their control. So that declined. But the third factor is also important, is that the level of support didn't increase, because that's what's needed to balance this triangle. Most people were not thinking about the senior leaders and their well-being. Even the senior leaders weren't thinking about their well-being. They were thinking about the well-being of their people, their employees.
And Paula, the study you did with Deloitte, you divided companies up, right, into the ones that were leaders and took really good steps to be ahead of this, and the ones that really weren't.
Yeah, well, one of the things that we do follow is we follow, what organizations do and the impact on their people. And we've looked at this in a number of different ways, so from the beginning of the pandemic, not just the Deloitte study, but we've looked at it in a number of different ways in our mental health index. And what we found is that when organizations actually put mental health and well-being at the center of their business continuity plan, their people did better. It was really sort of recognizing that business sustainability right now is less about your processes and technology. Like, we have all of that is pretty important, but that doesn't differentiate you. Everybody has access to the same things. The thing that differentiates you is whether your people are there for you, whether your people are focused, whether they're productive, whether they can deal with the ups and downs of changes. And what's required for that is clear support for them. So organizations where we saw CEOs, speaking honestly about and empathetically about the strain people were under, speaking about and destigmatizing mental health, because it was part of a business conversation where a business leader might stand hand in hand with a mental health leader and really help people understand what they were going through, where there was implementation of manager training to give them the skills to deal with the issues that they might be seeing in the workforce. And we had some wonderful leaders actually extend support, such as the AAP, even beyond the boundaries of their employees, to contract workers, part-time workers who typically wouldn't have benefits, because there was a realization that there was a need and the organization needed them as well. So a lot of very, very positive action. And when we saw organizations managing that support and managing that communication well, we actually didn't see the significant decline in mental health of their populations that we did in the working population overall. We
Well,
saw that it buffered it.
it's really interesting that you mentioned that there was concern about gig workers, basically temporary workers, or the ones that are not permanent workers. That's a real shift.
That is a very real shift, but it's a realistic shift. I mean, pre-pandemic, I mean, I'm almost thinking like it's AD and BC right now, but pre-pandemic, that point in time, a lot of the thought around workplace mental health led to things like, well, invest in prevention so we don't have disability costs, and only our benefited employees have coverage for disability. Not the people who are part-time, not the people who are contract. But that was only part of the puzzle, and it was always only part of the puzzle. And people are realizing that there is a bigger part of the puzzle, which is supporting your people's well-being helps their quality of life, and that also helps your business productivity. If people are feeling compromised, if they're not feeling psychologically safe, if they're not feeling supported, they're not going to be creative. They're not going to be innovative. Their customer service is not going to be great. So realizing how important it is for people and business, whatever role that you have, and if you have somebody who's a gig worker who is working as part of your business environment, then their well-being is equally as important as somebody who has benefits.
That's a really powerful statement. I hope that that kind of thinking continues after the pandemic. Okay, so say you are at an organization and you want to make sure people are mentally healthy, your leaders are mentally healthy. What are the concrete steps you should be thinking about?
It's a great question. I think there's several, and I'll start with two. I think it really has to be understood at the most senior level that this is a priority, because what you understand, what you believe, shapes everything that you do. As I mentioned a little while ago, organizations who recognized that the mental health was going to be a big part of their business continuity intuitively started to reach out for support. Our organization was called several times in terms of like, how do we deal with the situation? How do we say the best things? How do we make sure that we're doing the right things? So intuitively, they were driven to get the right information that was appropriate for them, and they took the right steps. I think right now, organizations need to realize that it is not just part of business continuity, but a business sustainability. We're seeing, resignations, we're seeing some people coming back into the office with angst and edge. It really is important for us to actually go forward successfully as a society to keep this front and center. So just that mindset is important. Very concretely, you have to talk about issues that are important. You have to make sure that people don't hide in the shadows, that they don't feel stigmatized, that you're reminding them constantly about resources that are available to them so they can take the right action themselves. The other thing that's really critically important, and I can't emphasize this enough, is to support your leaders, support your managers. We've had the majority of managers, 8 in 10, say that they had to deal with a mental health issue of an employee since this pandemic, and the vast majority didn't have any clue what to do. They didn't know how to deal with it. And that's an unfortunate situation, because it's an unfortunate thing for the individual because they don't get the right kind of support and guidance, but it also puts strain on the manager as well. So training your managers on how to support a mentally healthy environment, how to make sure that people feel a sense of belonging, how to make sure that people feel, that they're, recognized and that their well-being is important, but also how to deal with things when they are not, in the best possible situation is really critically important. And the third thing is just make sure that you have that continuum of support for your people. So look at your EAP, make sure that it's strong and promote it. Look at what else you might have in terms of services. Many organizations have been adding services, cognitive behavioral services, et cetera. Those things make a difference, and we've seen this in a measurable way.
Well, that sounds like you have to be really intentional about it, because what I've seen over the last year is, just going through one crisis after another, let's deal with this. It sounds like setting up a program, communicating constantly. Are companies doing that? Are you seeing it increasing?
Yeah, and you know what? I think I like the word intentional, because I think that is the starting point that I mentioned. If you really understand that that one of the and really understand that one of the pillars of the success of your business is the well-being of your people, then there's no way that you can think about any decision without thinking about that. So I really sort of wouldn't want it to feel like it's an extra thing. It's just a way of doing business that drives success. And actually, I'm so confident in saying that because I have access to information as a researcher, and I know that there have been studies, a number of studies actually, that looked at organizations even pre-pandemic who had that focus on the well-being of their workers, and in particular the mental health of their workers, and infused it as part of their business culture. And those organizations outperform their peers on the stock market. So it's there's so many good reasons to make sure that this is just part of your organizational thinking. And the good news is that organizations and business leaders don't have to be experts on every detail of what to do. You know, you have partners, you know, we as Lifeworks, other organizations are there for you to help make it easier for you to support your people. That's the reason why we exist.
Paula, thank you so much for talking to me today.
A pleasure.
Paula Allen is Senior Vice President, Research and Total Wellbeing at Lifeworks.